This year's Maryland Life Sciences Bioinnovation Conference is sponsored by Kite. Kite is a global biopharmaceutical company that is part of Gilead Sciences. Kite is based in Santa Monica, California, and has commercial manufacturing operations in North America and Europe. Kite's singular focus is cell therapy to treat and potentially cure cancer. As the cell therapy leader, Kite has more approved CAR-T indications to help more patients than any other company. MaxCyte. MaxCyte is an emerging global leader and trusted partner in the biotherapeutic, cell, and gene therapy industries. Headquartered in Gaithersburg, Maryland, we're proud to have supported the local life sciences community for over 2 decades. Our flow electroporation technology and next-generation expert platform helps accelerate, streamline, and improve drug development from research to commercialization. Now listed on NASDAQ with an IPO in July 2021, MaxCyte is attracting new investments to continue its commitment to enable and accelerate therapeutic programs. And Novavax. Novavax is proud to sponsor the 2021 Maryland Life Sciences Bioinnovation Conference. At Novavax, we are relentlessly committed to one goal: developing vaccines against the world's most urgent infectious disease threats. Our team of experts is working in partnership with leading organizations from around the globe to advance our pipeline, including our COVID-19 and seasonal influenza vaccine candidates. For more information about our efforts to combat the pandemic and to see our latest career opportunities, please visit Novavax.com. We'd like to thank these and all of our sponsors for their support of this year's Maryland Life Sciences Bioinnovation Conference.
We're giving people who have little or maybe no options another chance at being with their loved ones.
People here are really passionate about being here.
It's really rewarding to know that the work that we're doing here is going to help change people's lives.
We literally are getting bags of patient cells who have failed a previous therapy and they need help.
What we're trying to do is teach our patients' immune system to fight the cancer.
There's not a single thing that we do that doesn't have a direct impact on the patient.
What Kite has done in locating Maryland is really strategic.
Frederick County has been absolutely amazing to be able to help us to establish this very unique facility. We're really quite happy with our partnerships with the local communities here. So Hood College, we have a collaboration with them to where we initiated a lab jointly. I'm grateful to say that we're starting the apprenticeship with Frederick Community College. And these are the kind of things that I hope we start going outside and thinking a little bit differently and really engaging people who want to learn. And with the research coming up, it's going to be amazing where we see the site and also the industry in the very near future.
Our next segment is a fireside chat. Please welcome Marty Rosendale and Dr. Christopher Austin.
All right, good afternoon, everybody. So I want to thank you all. You've been a great audience so far today. And I'd like to remind those of you that are joining us via the conference virtual platform, if you look to the right side of your screen, there should be a Q&A function over there. I'm actually going to try something a little bit different. I brought some technology up here with me, and I'm going to monitor those questions as we're talking. So my guest today is Dr. Chris Austin. Dr. Austin is a CEO partner at Flagship Pioneering in Cambridge, where he serves as CEO of one of Flagship's franchise companies and advises on the operation and creation of other Flagship entities. Before recently joining Flagship, Dr. Austin served for almost a decade as the founding director of the National Center for Advancing Translational Sciences, NCATS, at the NIH, where he formulated the strategic vision and scientific directions of the new center. And he led its efforts in developing, demonstrating, and disseminating scientific and operational advances across the spectrum of translational science to get more treatments to more patients more quickly. Before NCATS, Dr. Austin founded and directed a number of scientific and technology initiatives at the National Human Genome Research Institute at NIH to derive biological insights and therapeutic potential from the human genome. He came to NIH in 2002 from Merck, where his work focused on genome-based discovery of novel targets and drugs. with a particular focus on common complex neuropsychiatric diseases. He received his AB in biology from Princeton and MD from Harvard Medical School. He did clinical training in internal medicine and neurology at Massachusetts General Hospital and completed a research fellowship in genetics at Harvard. And even though he's affiliated with those little schools north of us, we do consider him one of our own. Chris, welcome.
Thank you, Marty. It's great to be here. And I'm sorry I can't be with you there in person. I've been there in person every year for the last many years, except for last year, of course. And I'd hope to be with you there in person. But the exigencies of running a startup company have kept me here in Cambridge.
Yeah, we understand, but I have to say you are missing out. The in-person audience here is great. By the way, when we add our virtual audience to the in-person audience, we have about 2,200 people watching us right now, so no pressure.
Fantastic. Well, and I got to say, Marty, I want to make sure that people know that I'm a Baltimore boy. I grew up in Baltimore, and I am a diehard Orioles fan, no matter what happens. So, yeah, one's heart never leaves where one started.
Very good. So Chris, you're a physician, you're a medical researcher, you're the founding director of NCATS, where you focused on turning research into interventions. And now you're the CEO of a company, you're an entrepreneur, and you're an advisor to investors. That's a pretty amazing pathway, and I imagine it's a pathway that many of our scientists would like to follow. Can you tell us a little bit about your background and how you got there?
Yeah, sure. I, like a lot of people, had an early interest in science and how things worked, and had to make a decision whether I was going to go to PhD school or MD school, and never really was able to separate them. During medical school, I did a lot of research, and while I was doing research, saw patients at the same time. And if you ask, well, what has really driven me this entire time? It's really my connection to and care for patients who had illnesses that I couldn't treat or couldn't treat well, and that juxtaposed with the amazing science that I was able to do, even back in the mid '80s. When we thought we were doing amazing things in genetics, we were, but compared to what we can do now, it was really, really quite rudimentary. But bringing those worlds together is what has driven me since then, and it's not an easy road. Everyone on this call knows it's not an easy road. There's a lot easier ways to make a living, but there is none that is so fulfilling and gratifying. Throughout it all, I still think about the patients that I took care of 35, 40 years ago now. And they've always been my touchstone. What was interesting, and it's gotten a little bit better since the mid '80s, but what's always been interesting to me is the fragmentation and let's just call it for what it is, misunderstanding that there is between the various sectors who all want the same thing, whether you're a patient advocate, whether you're an academic researcher who's interested in helping understand fundamental biology as a basis on which to treat disease, you're a doctor who certainly wants better treatments for your patients, you're a drug company or biotech researcher who is trying to make a new therapy. We all want the same thing, and we tend to speak different languages, and we tend not to always be as respectful of each other as we should be, and that's something that, of course, affects the human condition. No matter where one goes, we have a remarkable ability to find differences in each other when there's much more we have in common. And so I've spent a lot of my career feeling like a translator in a linguistic sense, in a cultural sense, and there certainly is, I think, greater understanding among the various factions than there was before. I must say, having spent now time in all four of the big parts of our ecosystem, that is in academia, in big pharma, in government, and now in biotech, VC. The science and the medical problems are all the same, but the culture is quite different, and the capacity for not working together when it would benefit all parties, continues to be an issue. And I think, Marty, you and I have talked about that, and I think it's something that Maryland can really lead in, because it is just, I think it's just a very friendly, collaborative place where I've always thought that there's an enormous untapped potential in the Maryland capital region, particularly in Maryland.
Chris, that's great. I do want to come back to that idea of fragmentation and collaboration. We were talking about it a bit this morning. But you talked about in your roles, you've been the translator. You've had to translate for others the science and such. And now you've made the transition into corporate leadership. And interestingly enough, the founder of Flagship Pioneering is also a scientist, researcher who made the transition into being an entrepreneur. So what's that transition like for you? And are you still having to translate?
I find I'm translating different things. That is, I would say the things that are surprisingly the same, or perhaps not surprisingly the same, in retrospect, is first of all the science. The science is exactly as hard as it was in every other place I've been. Mother Nature does not give up her secrets easily, and that's certainly true in no matter what environment one is in. The other thing that is very similar is, of course, people. People are people, no matter where you go. And so, surprisingly, to me at least initially, I thought I would hear somewhat different things in each place from, the way organizations work. And fundamentally, I think as long as we have people, we're going to have some of those same issues. And that's good and difficult at the same time, I think what I don't have to do here, which I did have to do at the NIH, was explain the role of the private sector and the capital markets in bringing therapies to people. There is a profound lack of understanding in many parts of our scientific and policy maker ecosystem and medical ecosystem, profound ignorance about where therapeutics come from. We never get taught that in medical school, never get taught that in PhD school. And so as a result, there's a kind of magical thinking that goes on in many sectors, which is a real problem because it infects innumerable parts of not only conversations between academics and government officials and pharma and biotech companies, but also affects policies that you see are being considered in Washington right now, which could be quite problematic if they go through. And it's certainly not the case that anyone in any environment wants to endanger treatments for patients which are now a potential reality in ways that they never have been before. But it's the law of unintended consequences, and that has always troubled me. I wrote a lot about that when I was at the NIH, and have been talking about it a little bit here too. What's interesting about Flagship, for being the amazing organization that it is, there are very few people here who have ever had an experience in government. Steve Hahn, a lot of you remember, who's the previous FDA commissioner, is now at Flagship as well. But we are the first two people with any substantial experience in the government sector, which of course has an enormous impact in all kinds of areas of healthcare and product development. So I find myself translating, government to the private sector, and government to the academic sector, and academics to the private sector, and back and forth. And I think that's one lesson that I would give. Marty, we were talking about what did I wish I'd known if I could go back and talk to myself, 40 years before. One of those things would be to be an intentional bilinguist, be able to speak multiple languages. I mean, I can go into a meeting and I can speak academic so that you will think I'm a professor. And then I can go to the next room and talk business like you think I'm a business guy. And then you can go to the third room and talk like a drug developer, and you'll think that's all I do too. But as we experience when we go to foreign countries, you have to do as the Romans do. You have to speak the language of the organization or the part of the ecosystem you're in. And I think there are many times in our business where we're like the ugly American who goes to a foreign country, and when they're not understood, they just speak louder. We know that doesn't work too well. All it does is make people mad. And so I think having intentionally broad experience across at least 2 or maybe 3 or 4 parts of the ecosystem, have trainees go spend time, if they're an academia, go spend time in a biotech or a pharma. If one's in a pharma, go work at the FDA for a while. If one's any, go work at a patient foundation for a while. Oh my gosh, you will discover things that you couldn't possibly imagine. Just like if you go to a foreign country, you couldn't possibly imagine what you will learn being exposed to those different cultures. We don't do a great job at that in training, and I think we really need to, because it has tangible effects on our ability to translate into therapeutics.
Mm-hmm. Could we dig into that a little bit deeper? Because I think that's very sound advice, especially for young entrepreneurs. And then what I'm thinking is, they may already be at the point where they've got a technology or an idea and they're ready to become an entrepreneur, but may not have taken the path that you're describing. So is there advice that you could give to them? How might they get to some of this faster? Yeah.
Well, the good thing now is that there are not only courses that one can take, and Bio offers them. I know BioHealth Innovation there in Maryland offers it. So at least one is familiar with the terms that are used. But it's a bit like taking a 101 level language course. It does give you some familiarity with the terms, but you're certainly not a native speaker. There is no substitute in my mind, and no shortcut to taking time in your career and putting yourself in the thick of people who are doing something that you don't understand. And if it's in capital raising, go work in a capital raising organization for a year. You will learn an amazing amount, and you might think, oh my gosh, yeah, but I'm taking a year off of what I really want to do. This is a situation where you gotta go slow to go fast. That old analogy. I found in my early career that I could not frankly figure out why I found myself doing so many different things. I mean, Marty, you know this. I trained in a preeminent medical institution at the Mass General, fantastic medical training, and then right after that went and worked in a very basic model organism lab doing developmental neurogenetics. And then during that time, I went and worked in a hospital in Northwest Alaska in the middle of winter, worked in a hospital in Southern Africa for a while. I then, of course, made the next logical step and went to a big pharma to learn how to make drugs. And then, of course, the next logical step from there was to go work for the government. I mean, it's each step is to say, well, gosh, this guy just has occupational ADHD. He just can't keep his mind straight. But I think there was something in my personality I was lucky to have and privileged to have, which as Kierkegaard said, life only makes sense when viewed backwards, but unfortunately must be lived going forwards. And it all makes sense to me now. I couldn't possibly do what I'm doing without all of those experiences that I just told you about, because I understand everything from fundamental genetics and DNA sequencing to now CRISPR and iPS cells and things like that, all the way through how drugs are made, how patients get cared for in community and academic settings, and how care is delivered in parts of the world and parts of our country which have real health delivery issues. And that kind of air traffic controller view, where I've been privileged to learn over decades, these various pieces of our healthcare ecosystem, is something that I wish I had known. I needed to know early on, because it would have been less of a random walk and more of an intentional, like you go into college and you have distribution requirements and you got to take one of these and one of these and one of these. And the problem with our training system, whether it's medical or scientific, is that it tends to do the opposite. It tends to be like a totipotent stem cell that then becomes progressively and irreversibly differentiated into a more and more specific function and forgets all the other things it used to know how to do. And we need more people who are, if not totipotent, pluripotent. And so and that's something, again, that I think I haven't seen, whether it's in Maryland or now in Massachusetts or any other part of the country, a part of the country that has intentional systems to inculcate that kind of knowledge and practical experience. And again, I think that's something that Maryland could do.
It's interesting, your choice of words and analogies. You're clearly demonstrating that you can translate to business to scientists. That's great. So Chris, let's take a minute and talk about what you're doing right now. So you're the CEO of a biotech company. What are your priorities? What does your day look like? Yeah,
it's gosh, I don't need to tell you. It's a bit crazy. So I find that I'll use another analogy. It's like those of you who have spent time on a microscope know that you're constantly going from low power to high power and back again, and that's really what this job is like. At its most fundamental, it's like being a lab head again, where I'm looking at primary data, helping postdocs and scientists at various levels of expertise understand their data and plan experiments. The company is only about 25 people, so we really are that small. I must say that is great fun and something I really missed. I got to do a little bit when I was running an institute at the NIH, but not as much as I would have liked. So I love having more of that. At the same time, in a way that academic investigators don't frequently need to do, I have to think about the bigger picture. That is where this company is going to be 2 years, 1 year, 5 years from now, and how we are going to demonstrate value, not knowledge, but value to our investors. And so, of course, that leads immediately to the question of who are our investors. If the way Flagship works, and we might want to talk about this, it really depends. But I think you'd find the model interesting either for now or perhaps for a future conference, that all the funding that my company has that it's now been going on in one way or another for about the last 2 years, for a year and a half before I got here. All that has been funded by Flagship itself, no external money, and will be until the Series B, which I'm now spending a huge amount of my time on. The pitch deck, the financials, what the business case is going to be, and then vetting that with the remarkably experienced group of both scientists, entrepreneurs, and finance people here at Flagship. So I'm not having to do this on my own because, of course, this is something I've never done before, the finance part. And I've worked with a lot of people who have, but I've never done it myself. And I think we all know that watching somebody else do it and doing it yourself are two completely different things. And so I'm spending a lot of time teaching myself about finance firsthand. So, in one day, it could be one day I'm looking at, results of an experiment in iPSC differentiated cells into microglia. And then the afternoon, I'm talking about portfolio analysis and what other diseases we might want to move into. And then, in the evening, I'm working on the Series B deck. But it is very exciting. We're not quite in log growth phase, but we are very busy hiring, and so our hiring plan is to quadruple in size in the next year and a half, and of course that creates enormous pressures on finding good people and finding lab space, which in the Cambridge region at least are both extremely difficult. I think it is just remarkable to me how great the need is for scientists, well-trained scientists at every level, from the most inexperienced right out of training all the way up to the highest level. The job opportunities and the scientific and medical opportunities are just extraordinary. And I know, just like in Maryland, our limiting reagent, if you will, I think of it in a biochemical way, is really the people, the well-trained people. I often say I just bought a house up here, which was not a fun experience, I must say, because we had about 10 other people who wanted the same house, and hiring people is about as hard as finding a house. There's always multiple other bids, and you have to go above what you hope for, and I think, though, that's a short-term problem, and I think really is, could be, and I think even is now, a limitation to value creation. I think over the long term, it's a very promising secular trend for those who are in training now.
So Chris, first of all, I want to say I know lab space is tight here as well, but I bet we could find a space for you if you want to come back.
I know. Well, it is, it's been fascinating for me just in the last 5 months that I've been here to be able to see the difference between what's going on here and what's going on in the ecosystem in Maryland. They are different. And I had, Marty, as you know, I've been privileged to spend 5 years on the Governor's Life Science Advisory Board with people like Dan Abdenabi and Jay Perman and so many other incredible people, entrepreneurs, policymakers, et cetera, in Maryland. And we did a lot of work to benchmark ourselves against other places. And of course, the places we looked at the most were Cambridge and San Francisco, but we looked at all the other usual places. And I think what strikes me here is the same kind of reality that is even more acute in the Bay Area, but not as acute in Maryland, which is the geographic limitation of the work, which is in the short term. I think both Cambridge and San Francisco discovered this, is an enormous positive. I mean, I walk out the door here, and it feels like I am in biopharma Disneyland. You know, instead of walking by the Space Mountain and the Pirates of the Caribbean ride, I'm going by Amgen and Pfizer and BMS and Google and entire buildings full of 100 biotech startups, and it's extremely concentrated area, which has been really one of the sources of growth here, but it's already starting to become limiting. I mean, sometimes I used to, back in the old days, I used to grow up E. coli in Luria broth and LB. A number of you probably will know what I'm talking about. And you know, the problem is, whenever you get log growth phase until you run out of food, and then it's not so great because you can't grow. You know, you need to be able to get in a larger Erlenmeyer flask, and it's quite difficult to do that here. Just geographically, it's quite difficult. The Bay Area has already run into this. Maryland's problem, I think, over a period of time is that, you know, Maryland, as I hope all of those listening knows, is not a city; it's a state. And we got to realize this at an LSCB meeting once. You know, we were saying, well, we're comparing ourselves with Cambridge and San Francisco and San Diego and Maryland. Well, of course, these are small, concentrated areas, whereas in Maryland, we just had the spot from Kite in Frederick County, which is wonderful. It means you can have space, often as much space as you want, but it means that the concentration of people and capital is less so. So the question is always, you know, how do you bring Maryland together in a virtual way to feel like Cambridge, but also to realize as the place grows, it's going to get a lot more crowded all by itself, and I think that will be a good thing for the Maryland region.
Mm-hmm. So Chris, let's come back to your day to day. You mentioned teamwork, raising money, and you're preparing to go out and raise a Series B. We talked about that teamwork a little bit when we spoke the other day. You know, I think a lot of our new entrepreneurs, our younger entrepreneurs, feel like they're in this on their own. Can you talk about that teamwork a little bit and more, and why it's important?
It really is critical. You know, and Marty, you know this. I've always been an enormous team booster. I think it's plain why that should be the case in our business. As I often say, it doesn't matter how smart you are, doesn't matter how well trained you are, doesn't matter how hard you work. You cannot do this alone. You cannot make a drug and commercialize it all by yourself. It requires just the scientific side requires 20 different disciplines. I did have calculations. 20 different disciplines that are as different as biology and chemistry and informatics and pharmaceutics and clinical trials, et cetera. And then you add the whole aspect of people who went to business school instead of medical school or graduate school. And you realize you just can't do this on your own. You need to reach out to people who have first-class expertise in this, or else you will fail. There's just no way around it. So one of the reasons that I decided to come to Flagship was that the environment here and the way the firm is set up is that little companies do not have to do everything themselves. I mean, we are my own company has support for all the back office functions supplied by Flagship. The HR and hiring and lab space and the accounting, all of those things are done for me, and that's all done in kind. I mean, that's in addition to the funding that the organization provides for our ongoing operations. But increasingly importantly, but of course obvious to the people who run Flagship, is that this organization runs on capital from the capital markets. So it is as essential to an organization like this to have a specialized group that does that as it is for an academic institution to have what's frequently called a sponsored research programs office, the office that helps academic entrepreneurs who are trying to get grants to help them do that. And virtually every university has that. The idea that an academic researcher would be able to navigate the labyrinth of grant application systems and financial controls and all these things is unthinkable. And yet we sometimes do that on the private sector. We say, well, gosh, you're an entrepreneur, go figure it out. But it can be done. There are people who, like in anything, there's always a Mark Zuckerberg type out there, to show us that there really are extraordinary people occasionally who can do this on their own. But for most of us, it's an impossibility. So Flagship has a very large operation run by Steve Berenson, who's an investment banker, spent his whole life in capital raising in the private sector, and now runs Flagship's finance side. And so before I go out with my pitch, I am going to have to pass muster with all of these folks who are on my team. They want me to succeed. But these guys are like talking in front of Shark Tank. They are a bunch of tough characters, and that kind of teamwork, of comradeship, and teamwork in known, I think is absolutely incredible, absolutely critical. I wouldn't have come here had I not known that I could avail myself of that here.
So Chris, if a company doesn't have a flagship yet, what are your thoughts around, until they find maybe a venture firm that could become their flagship, or some other key investor? What are your thoughts around utilizing investment bankers or investor relation firms or other contractors to fulfill that team approach?
Yeah, you have to, and I think the only thing I would urge, and it will not surprise you to learn that I talked to many others before I decided to take this position. I would have been in that situation. To have a conversation with them about what motivates you and what motivates them and what their time frame is, it might surprise you, and it surprised me when it first happened. When I got on the phone with one of these folks, it was completely different than Flagship, but it was when I was trying to figure out, where could I apply my skills next? What would be the next phase in my career? One of these folks you're referring to, a financial person, the first thing he asked me was, "What do you value? What motivates you?" And at first I thought I'd gotten on the wrong phone call and I was having a therapy session instead of a session about fundraising. But his question was, if I'm going to team with you, I need to understand what you view as success. Is it being able to flip a company in a year? Is it getting a treatment all the way to people and market it all by yourself? What exactly is it? So I think you have to do that. The problem, of course, with that, but the reason that there's no shortcut to this kind of due diligence, is that there's lots of people out there who will offer their services, who may in the end not be a good partner, and who may turn out to have financial expectations that are a little bit different than yours, and so you got to understand that up front, and they're difficult, uncomfortable conversations. But if any of you have ever interviewed a financial advisor, it's a similar kind of conversation. Or if any of you are married, some of the similar kind of conversation, about what are we about? And anyway, but there are lots of firms out there who will do this for you, but it's just caveat emptor.
It sounds like you're advising that if somebody's looking at working with a contractor like that, they ought to do as much due diligence as that contractor is likely doing on them to make sure that it's going to be a good relationship. So,
because I think what I've seen is that often, we as scientists, I think, and maybe we're not unique to this, I don't know, but I think as scientists, we tend to overestimate how transferable our insights are into other areas. And so what I mean by that is we say, well, gosh, I'm an expert on autophagy, so autophagy is really hard. How hard can finance be? So all I need is somebody to kind of help me along. But I can handle that finance stuff. Oh boy, do not do that. But we as scientists, we're pretty proud of what we know, and I've seen this happen. People underestimate how hard the financial aspects are, and that's really a tragedy to see, because you see sometimes amazing science, just amazing science, and amazing people that fail because of this reason. And so, yes, the due diligence is absolutely important. And if I'd say of that due diligence, the most important thing is what is your time frame and what is their time frame. Mm-hmm. Because that determines a lot of success and failure.
So Chris, time is flying by. We have just over 6 minutes left, so we can probably get in one or two questions. I don't know if there's anyone in the live audience that has a question, but the technology is working. So there's a question here that relates back to you talking about your experience and the need for diverse experience. And what they're asking is that, the other option here might be to bring in people into healthcare that come from outside of healthcare and teach them healthcare. But there seems to be a resistance to doing that. What are your thoughts around that?
I'm a huge fan of what was suggested. As a matter of fact, my experience has been that the more diverse the group, including people who most people would say have no business working in healthcare, the more successful I've been. It's 100%. So there's a linear relationship between the unusual suspects quotient and the success quotient. It's rare though, and it's rare because scientists, like all other or many other human entities, tend to be kind of cliquish, and we look for people who are like us and think like us or trained like us or look like us. And in science, that's a recipe for disaster. I mean, it's been well known. You probably all know this. History of science is punctuated by major changes, major scientific revolutions happening because two fields that have nothing to do with each other, in quotations, coming together, and that's where the big changes happen. Now, the most recent, perhaps, is this something well established now, but the coming together of biology and engineering, which, when I was in training, they had nothing to do with each other, and now they work very closely together. The original molecular biology, as you probably all know, was the bringing together of physics and biology and became molecular biology. And I had this experience, believe it or not, at the NIH working with NASA, and learned an enormous amount from fighter pilots who are astronauts. So we don't have time to get into what I learned from that, but you might say, wait, you have an astronaut on your project development team? And the answer is yes. And so I think what you are suggesting is not only a good idea, it is at least part of the solution. It's not the only solution, but it's definitely part of the solution. If you want people who are able to not be beholden to the current status quo and all the dogma that holds us back, whether we know it or not, then you got to do one of two things. You either got to hire a bunch of 12-year-olds who are help you fix your computer and will make you think different, and or you have to look for people who have different experiences than you, and that's a countercultural thing to do in our PhD, MD, Harvard, driven world. I mean, but I sometimes feel, one of the reasons that I'm able to do this is that, I come from those kinds of places, and I realize that, they're wonderful places, but it's a lot they don't know there. I'll just leave you one anecdote or one example of what you're talking about. One of the best people I had at NCATS when I was there, we hired from a bicycle shop. He was a bicycle repairman and now runs a good part of our automation. And I don't think most of the time, if you said, I've got this CV of a guy who works at a bicycle shop, oh yeah, he'd be great, let's put him on the team. But it's a great example of what you're talking about.
Mm-hmm. Yeah, I know early in my career, I was working in a biotech company, and one of our top scientists, actually, this company was focused on organ transplantation, but one of our top scientists came from the Jet Propulsion Laboratory. And,
yes.
And that perspective, he was amazing.
Yes.
So, one more look around, see if there are any questions from the live audience. Doesn't look like it. Oh, one hand up in the back of the room. So, Chris, I don't know if you could hear. The question is, the person you hired from the bicycle shop, how did you find him? Was it networking? I mean, what drove you to him? How did you find that person?
Yeah, it was totally happenstantial. It was one of our automation engineers who went in to get his bike fixed, and they started talking about this. And the critical thing was the prepared mind of the person who worked at NCATS. That is, he had in his mind a much more open view of where talent came from, very much like your question, and that he was very good at looking for people who were talented with their hands and could think differently about a problem. And the problem that he had with his bicycle was a little different. And the innovation that he brought to that problem, he thought, wow, here's sometimes is said, here's a Cadillac guy working in a Volkswagen job, and so why don't we see how he does? And of course we hired him as on a sort of temporary basis to begin with, but he just flourished since then.
Yeah. So, Chris, our time just ended. We timed this perfect, I think. And I just want to say thank you for your time. Thank you for coming back to us. Appreciate it. And until such time as we can attract you back permanently, we're going to consider you our double agent up there. All right?
Yes, well, please do. You know, my heart's never going to leave Maryland, so I'm glad to do whatever I can to help and bring a little of the magic that's up here down there. I just for those of you who don't know, you know, it is not a fait accompli that Cambridge always has been and always will be the center of the biotech universe. You know, when I was in medical school here, East Cambridge, where I'm sitting now, didn't have a single biotech in it. It was mainly kind of rundown old industrial manufacturing area. Many people forget that. They think it's always been that way. It was a combination of forward thinking of the people in the state government and the university leaders here. Amazing talent, of course, from the colleges and universities here, and what grew up as a very supportive and innovative VC culture, which led to this. But it's essentially all happened during my professional lifetime, and there is no reason at all that the same thing could not happen in Maryland and should not happen in Maryland.
Right. Good words to close on, Chris. Thank you so much for your time this afternoon.
Thanks, Marty. Take care. We'll be in touch.
This year's Maryland Life Sciences Bioinnovation Conference is sponsored by Avantor. From breakthrough discovery to agile delivery of mission-critical products and services, Avantor is a trusted global partner to customers in the life sciences and advanced technologies and applied materials industries. Our leading global customer channel, VWR, offers an integrated, seamless purchasing experience. For more than 23 years, we have collaborated with BioBusiness Solutions to play a critical role in helping members develop scientific breakthroughs. We set science in motion to create a better world. The Maryland Department of Commerce. Welcome to Maryland, where day by day, dreamers are becoming doers, makers, and pioneers of the future. And while the state's code breakers, vaccine makers, and next-gen manufacturers are pioneering our future, they're doing it in a place that's best for their future. Make a move to Maryland to take advantage of our natural business assets, boundless resources, and amazing quality of life. The Montgomery County Office of Economic Development. Commercialize your science near the world's top scientists at NIH and FDA. Connect with us at thinkmoco.com to find your success in Montgomery County, Maryland, the immunology capital next to the nation's capital, and the Pharmaceutical Research and Manufacturers of America. Pharma represents the country's leading innovative biopharmaceutical research companies, which are devoted to discovering and developing medicines that enable patients to live longer, healthier, and more productive lives. Since 2000, pharma member companies have invested more than $1 trillion in the search for new treatments and cures, including $91.1 billion in 2020 alone. We'd like to thank these and all of our sponsors for their support of this year's Maryland Life Sciences Bioinnovation Conference.